Hi, my name is Brian Stears. I'm a nurse. I'm going to be doing a full head-to-toe assessment on Mrs. S, who was granted permission to be recorded on this video assessment. Okay, Mrs. S, I'm going to inspect and palpate your head and face, looking specifically at color of the skin, temperature, moisture, texture, edema, skin turgor, lesions, scars, scar here, bruises, or nevi. I'm going to look at your head. I'm looking at for size, symmetry, and then midline position. Good. I'm going to inspect and palpate your head and your scalp. I'm looking for hair color, texture, and distribution, as well as I'm checking for lesions, tenderness, depressions, or infestations. Is there any tenderness?
No.
I'm going to inspect and palpate your temporal artery. Is there any tenderness?
No.
Okay. I'm going to inspect and palpate your lymph nodes, your occipital, post-auricular, preauricular, your tonsillar, your submandibular, submental, anterior cervical, posterior cervical. Can you raise your shoulders? Your supraclavicular. Okay. Now I'm going to inspect your fifth cranial nerve. Can you clench your jaw? I'm looking at your masseter muscle here. Good. This is checking the motor response. Now I'm going to check the sensory. Does that feel the same? Both sides? Is that the same on both sides? Is that the same on both sides? Is that the same on both sides?
Yes.
Okay, now I'm going to inspect your seventh cranial nerve. I'm looking for symmetry here. Can you smile? Good. Can you frown? Good. Can you raise your eyebrows? Good. Can you puff your cheeks? Good. And can you purse your lips? Good. I'm going to inspect your outer ear for shape and position. Good. Now I'm going to take a look at your external auditory canal on both ears, and as well as your tympanic membrane with the otoscope. Good. Good. Now I'm going to palpate your tragus, your pinna, masses and tenderness. Any tenderness?
No.
Good. Now I'm going to perform a couple of tests that assess your eighth cranial nerve. I'm going to start with what's called the whisper test. What I'm going to have you do is start with your left ear. I'm going to have you put your finger on your tragus and move it in a circular motion. I'm going to whisper something to you and have you repeat that back to me.
Okay.
Okay.
3x7.
Good. Now switch hands. Do the same thing on the opposite ear.
4j6.
Good. Now I'm going to perform the Weber test. I'm going to do this by hitting the tuning forks. I'm going to place it in the middle of your head. And I want you to tell me if you hear it better on the right side, on the left side, or if you hear them both equally on each side.
Equally.
Good. Now I'm going to perform the Renee test. I'm going to see if I'm going to compare the air conduction versus the bone conduction. I want you to tell me when you stop hearing it on the back of your bone and then I'm going to put it next to your ear and tell me if you still hear it, okay?
Okay. Okay, I can't hear it. I can still hear it.
Good. Now I'm going to do it on your right ear.
Okay, I can't hear it. I can still hear it.
Good. That's a normal test. I'm going to assess your eyelashes, your eyebrows, as well as your palpebral fissure. Good. Now I'm going to take a look at your sclera and conjunctiva. I'm looking specifically at the color, see if there's any lesions or discharge. Good. Now I want to test your gross visual acuity. Can you look over there? There's a Snellen chart that's about 6 meters away. Can you read the small sign for me? And before you do that, do you have any glasses?
No.
Do you wear glasses? Okay.
A, B, C, D, E.
Good. Now I want to test your second cranial nerve. I'm going to do this by looking at your peripheral vision as well as your central vision. So I'm going to have you look straight at my nose, and you're going to tell me which finger is moving. Are you ready?
That one. That one. Both.
Good.
That one. That one. Both.
Good.
That one. Both. That one.
Good. Now keep looking straight at my nose, and I want you to cover one of your eyes with your palm. Good. Is there any part of my face that's missing?
No.
Good. Now with the other hand. Any part of my face that's missing?
No.
Good. So now cover your left eye. I'm going to cover the opposite. And I want you to tell me when you see my finger moving.
No. No.
Good. Now keep that eye.
No. No.
Good. Now with the opposite eye. And I'll cover my opposite eye.
No. 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 No.
Good. Now I'm going to take a look at your pupillary response. This will test your third cranial nerve. Good. I also want to do another test on your third cranial nerve. I'm going to look at accommodation. So take a look at my nose and follow the pen all the way in. Good. Now look at my nose. I'm going to test convergence. Now look at the pen. Good. So now I'm going to do another test that's going to look at the cranial nerves 3rd, 4th, and 6th. This is going to test your extraocular muscles. I'm going to have you look straight at my nose, and then I'm going to have you follow with your eyes my pen. Are you ready?
Mm-hmm.
Good. And if I had a ophthalmoscope, I would look at your internal eye structures as well as I would look at your red reflex. I'm going to inspect your nose to see if it's straight in midline. I'm going to check for patency of your nares. I'm going to occlude one side and have you breathe in slowly through the nose. Good. Good. Now I'm going to palpate your frontal and maxillary sinuses. Is there any tenderness here?
No.
Good. Is there any tenderness here?
No.
Good. I'm going to be focusing my exam specifically on your throat and mouth. Can you open your mouth for me? I'm taking a look and inspecting your lips, your teeth, your gums, mucosa, your palate, your tongue, under your tongue. Can you lift your tongue? Good. Your salivary ducts. Good. Your posterior pharynx, as well as your tonsils. I would grade your tonsils 1, as well as your Malampati class as 1. Now I want to look at your TMJ. I'm going to palpate your TMJ. I want you to open your mouth and then close your mouth. Is there any tenderness as you do that?
No.
One more time. Okay. I don't feel any subluxation or crepitus. Now I want to assess your 9th and 10th cranial nerves. I'm going to do this. I'm going to have you open your mouth. You don't have to eat quite yet. I'm going to have you open your mouth, and then I'm going to have you say ah. And with that phonation, I'm going to look to see if there's a symmetrical rise of your soft palate as well as your uvula. Okay, can you open your mouth for me? Say ah. One more time. Good. So I'm going to take a look at your neck. I'm going to inspect it, looking specifically at the color, the temperature, the moisture, see if there's any texture, edema, skin turgor, lesions, bruises, I don't see any, nevi, and then scars. Was this from a thyroidectomy? Okay. Now I'm going to palpate your trachea. I want to make sure that it's midline and that there's no deviation. Okay. I'm also going to palpate the thyroid area. I do not feel a thyroid, which confirms a thyroidectomy. I'm now going to feel your carotid pulse. Make sure that there's pulsation on both sides. I'm also going to auscultate to make sure that there are no bruits heard. Now my stethoscope does not have a bell, so I touch lightly on there, which takes place of the bell. I'm going to test the range of motion of your neck. So can I have you follow what I tell you to do? Can you do flexion of your neck? Bring your chin to your chest. Good. Can you do extension of your neck? Bring it back. Now hyperextension is back as far back as you can. Good. Now can you do lateral flexion? Bring it to the side. Now the other side. Good. And now rotation. Touch your chin to each shoulder. Good. Now I want to test your 11th cranial nerve. I'm going to do this by putting resistance against your shoulders as you shrug them. Okay, straight your shoulders. Good. I'm going to examine your posterior chest. I'm going to first take a look at the color, the temperature, the moisture, the texture, if there's any edema, the skin turgor, any bruising, lesions, scars, levi. I don't see any signs of respiratory distress, no accessory muscle use, no nasal flaring, no retractions, no tripoding positions, no cyanosis. I'm now going to look to see if everything is midline and that there's no obvious deformities, and I don't see any. I'm going to palpate for symmetrical chest expansion. So what I'm going to do is I'm going to push in a little bit and have you take a deep breath in. One more time. Good. So now I'm going to do several exams that are going to evaluate for consolidations. The first one that I'm going to do is look for tactile ephemeris, make sure it's symmetrical on both sides. I'm going to place my hands in different positions along the side of your back, and each time I push down, I want you to say 99.
99, 99, 99, 99, 99, 99.
Good. Now I'm going to percuss different spots on your back. This is also checking. I'm going to take a listen to your back as well. I just want you to take normal deep breaths. I'm also going to listen to your right middle lobe, which is best heard under the right breast. Just breathe normally for me. Okay, good. Now I'm going to do a couple more tests that follows what I just did. The first one is called agophony, the second one will be called bronchophony, and then the third one will be called whispered pectoriloquy. So the first one I'm going to have you do is each time I put my stethoscope down on your back in each of the different lung fields, I want you to go E. Similar to what we just did, and I'm going to have you say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Good. On this last one, I'm going to have you also say 99 with each placement of my stethoscope, but I'm going to have you whisper it. I'm now going to repeat what I did with the posterior chest, doing that tactile fremitus, making sure that the fremitus is symmetrical, and repeating the 99 again.
99, 99, 99, 99, 99, 99.
Good. And now I'm going to take a listen to you. Just breathe normal. Okay, Mrs. S, I'm going to take a listen to your heart. I'm looking at 5 different areas. I'm going to look at your aortic area, your pulmonic, the valves, as well as your Erb's point, your tricuspid, and your mitral valves. I'm now going to identify where your PMI is. It's 5th intercostal space, mid-clavicular line. I'm going to palpate there. Okay. Now I'm going to take a listen to your apical pulse for 1 minute. You had a rate of 72 beats per minute. I did not hear any murmurs, and I heard a normal S1 and S2. Okay, so now I'm going to have you lay down. Good. I'm going to inspect for a couple different things. I'm going to inspect for heaves, lifts, and thrills. I'm just going to take a listen to you again lying down. Okay. I'm going to sit you up 30 to 45 degrees. And I'm going to assess for jugular venous distension as well as palpate your pulses. No JVD noted. Good. Okay, Miss S, I'm going to do an abdominal exam now. I'm going to look at the skin first. I'm looking at color, temperature, moisture, the texture, any edema, skin turgor, lesions, bruising, scars. Nice to get out here. I'm now going to look at the abdomen for symmetry or contours. I'm going to auscultate for bruise. I'm going to auscultate the aorta, your renal arteries, your iliac arteries, and your femoral arteries. I'm now going to auscultate all 4 quadrants of your abdomen. Good. All sounds are active. I'm going to percuss each one of your quadrants as well. I'm listening for dullness, flatness, and tympany. Okay. Gonna feel for any masses or abdominal tenderness. Is there any tenderness? Good. I'm gonna palpate the liver as well as the spleen. Good. Can I have you sit up? I'm going to percuss for CVA tenderness here on the back. Any tenderness there? Tenderness there?
No.
Now do an examination of your upper extremities. I'm going to look at the overall warmth, color, and integrity of your upper arms. I also do not see any edema. I'm going to look at your capillary refill. Less than 2 seconds. Assess your radial pulse. Good strong pulses. I'm now going to look at the hands. I'm going to inspect and palpate for redness, swelling, deformities, tenderness, crepitus, nodules, and symmetry. And that looks good. Okay, and now I want you to do a few, some range of motion with your fingers. Can you do flexion, extension, hyperextension? Good. Adduction, abduction, good. And thumb opposition. Good. Can you squeeze my fingers? Good. 5 out of 5 strength on both sides. Okay, now I'll do an inspection of the wrists. I'm going to do the same thing. I'm going to palpate for redness, swelling, deformities, tenderness, crepitus, nodules, and symmetry. That looks good. Can you do the same thing? Can you do flexion of the wrist, extension, hyperextension, ulnar deviation, radial deviation, and then rotation, both sides. Good. I'm gonna fill the elbows now on both sides. Same thing, I don't see any redness, swelling, deformities, any tenderness, crepitus, nodules, and they're symmetrical on both sides. Can you do flexion, extension, hyperextension? Good. And then can you do flexion against resistance? Good. Extension against resistance? Good. 5 out of 5 strength on both sides. Now I'm going to take a look at your shoulders. I'm going to feel the same thing for any crepitus there. I'm going to look for redness, swelling, any tenderness.
No.
I don't see any deformities, any nodules, symmetry on both sides. Okay, can you do flexion? Good. Extension. Hyperextension. Good. Abduction. Adduction. Good. Can you do abduction against resistance? Good. Now adduction against resistance? Good. And then can you do rotation? Good. 5 out of 5 strength on both sides there as well. Okay, so now I'm going to do a couple of tests. Can you close your eyes? Does this feel the same on both sides?
Yep.
Does this feel the same on both sides?
Yep. Excuse me.
Good. Which side am I touching? Good. Which side? Which side?
Both.
Good. So now I'm going to do something that's called stereognosis. I want you to keep your eyes closed, and I'm going to put an object in your hand, and you're going to tell me what that object is.
A button.
Good.
Chapstick.
Good.
Keys.
Good.
And a pen.
Good. Okay, now I'm going to do something that's called graphesthesia. I'm going to take the palm of your hand and I'm going to spell a letter in it. And you tell me what that letter is.
W.
Good.
E.
Good.
B.
Good. Okay, I'm going to do vibratory sensation of the wrist. Can you feel that?
Hurt?
Can you feel the vibration? Can you feel that?
Yep.
Feel that?
Yep.
Good. So now I'm going to do another test checking your cerebellar function. I'm going to have you do serial finger touching. Do this. Both sides. Good. Now I'm going to have you do hand flip-flopping. Now I'm going to have you do finger to finger. So when I do this, I'm going to have you bring your arms out wide and touch your index fingers together. Good. Now do that with your eyes closed. Good. So now I'm going to test your reflexes. I'm going to start with the brachioradialis. Good. Now your biceps tendon. Good. Good. Now your triceps. Just relax. Good. Now I'm going to assess patellar tendon on your lower extremity as well as your Achilles tendon. And then I'll have you swing your legs up and we'll do the Babinski, just so we can get it in the camera. Relax. Okay. Dorsiflex. Good. 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 I'm going to now be doing an examination of your lower extremities. I'm going to look at your overall warmth, color, and skin integrity first. I don't see any edema. Good. I'm going to test your capillary refill. Good. Less than 3 seconds. I'm going to check your posterior tibialis. 2+, as well as your dorsalis pedis. 2+ there as well. I'm now going to take a look at your toes. Again, same as the upper extremities. I'm going to be looking at redness, deformities, swelling, tenderness. Is there any tenderness here? Crepitus, nodules, and symmetry. Looks symmetrical. Can you do flexion of the toes? Of just the toes. Good. And then extension. Hyperextension. Good. And then adduction. And with it just your toes. And abduction with the toes.
I don't do that.
Good. Now I'm going to look at your ankles. Again, I'm assessing the same thing. I'm going to be looking at redness, swelling, deformities, tenderness. Is there any tenderness there? Nodules, crepitus, and symmetry. I don't see any issues. Now I want you to do dorsiflexion first. Good. Now plantar flexion. Now inversion, eversion, and then rotation. Good. And then can you push against resistance? Good. Plantar flexion. And then dorsiflexion against resistance. Good. 5 out of 5 strength on both sides. Now I'm going to look at your knees. I'm going to be assessing for the exact same thing. I'm looking for redness, swelling, any deformities. Is there any tenderness? Nodules, crepitus, and they look symmetrical to me. I'm going to test your strength. Can you do flexion? Good. Against resistance. Now extension against resistance. Good. And now I'm going to do with the hips. I'm just going to have you do right now adduction against resistance and then abduction against resistance. Good. I'm going to test vibration again, the vibratory response on your medial malleolus. Feel that?
Mm-hmm.
Feel that?
Mm-hmm.
Feel that?
Yep.
You feel that? Good. So I'm going to do light touch sensation real quick on your lower extremities. Does this feel the same?
Yep.
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 Which side am I touching?
Left.
Good. Side am I touching?
Right. Both.
So now I'm going to take a look at your hips. I'm going to touch here, assessing for redness. Check both sides. Good. Swelling, deformities. Is there any tenderness?
No.
Good. Nodules, crepitus, and it looks symmetrical on both sides. So now I'm going to test some range of motion with your hips. Can you do flexion, extension, hyperextension on both sides? Good. Circumduction. Good. Abduction. Adduction. Good. And then internal rotation, external rotation. Good. Now I'm going to take a look at the knees with the range of motion. I'm going to have you do extension, flexion, and then hyperextension. Good. Good. Now I want to take a look at your back. So I'm going to be looking here to see if there's the normal alignment, curvature. Is there any tenderness with the spine?
Nope.
Okay, so I'm going to have you do a few range of motion exercises as well. Can you do flexion? Good. And while you're in flexion, I'm going to look for scoliosis. I do not see any scoliosis. Okay, now do extension, hyperextension. Good. Now lateral rotation, lateral flexion. Good. So now we're going to do a test called the Romberg test. So I'm going to have you close your eyes, and I'm going to see if you can keep your balance while you're closed. Eyes are closed. Good. You can open your eyes again. I'm going to assess your gait, regular and tandem. So I just want you to walk normally towards the camera, just a few steps. Okay, now you can come back. And now do tandem. Tandem, I'm just going to have you put one foot in front of the other. Good. Okay, now you can come back. Good. Now I'm going to have you hop in place with just one foot on each side. Good.